Yeah, my name is David Lefkowitz. I'm a primary care doctor here at SciMed Health, and I've been here for 8 years. I work in the Gainesville and Chiefland offices. So hepatitis at its most basic is inflammation of the liver, um, but viral hepatitis is one of 5 viruses typically, and that's A, B, C, D, and E, and hepatitis A, B, and C are the most common. So hepatitis A is transmitted through infected feces. It can be transmitted sexually, but most of the time it's through contaminated food or water. Um, Hep A causes a acute infection, meaning it causes an infection that's self-limited. So somebody will have it and they will get over it. A lot of GI symptoms. It does not cause chronic infection. So that is what makes it a little different than the other hepatitis viruses. Most people have it and they get over it, and there are very few deaths from hepatitis A, which is the good news. And in those people who do get severe infections usually have underlying immunocompromised conditions, things like that. So hepatitis B is a little different because hepatitis B is transmitted through body fluids, so things like blood or semen, and also is easily transmitted from infected mothers to their babies. Of the adults that get hepatitis B, about 5% who get the acute infection will go on to develop chronic infection. And of those 5%, about a quarter of them will go on to develop severe liver disease, things like cirrhosis or liver cancer. The good news being that only 5% of adults go on to develop chronic infection, but the bad news is that 95% of the infants that have it, that are born to the infected mothers, will go on to develop chronic infection. And those kids, if they're not treated, don't do well at all. And so that's why all babies right at the time of birth get their hepatitis B vaccination. So hepatitis C, like hepatitis B, is also transmitted through body fluids, so blood and semen. The biggest risk factor being transmission through the blood, mainly through dirty needles, IV drug use, and things like that. It can be transmitted from infected mothers to their babies, although less so than hepatitis B. Of the people that get acute hepatitis C infection, about 70% go on to develop chronic hepatitis, and of those folks, 15 to 25% then will go on, if untreated, to develop severe liver disease, things like cirrhosis or liver cancer. Viral hepatitis, because it's like most viruses, can cause the typical viral symptoms, things like fever, body aches, nausea, vomiting, that kind of stuff. There are some symptoms that are a little more specific to hepatitis because it inflames the liver, and that is things like jaundice, that's yellowing of the eyes or skin. It can cause a light or clay-colored stool, and it can also cause dark urine. Hepatitis A specifically is notorious for causing diarrhea, whereas the other, like hepatitis B and C, don't typically. They can, but hepatitis A is notorious for that. And sometimes with an acute infection, there are no symptoms. Hepatitis C is a good example. A lot of people don't even have symptoms of hepatitis C. They may just have it living inside of them, and that's why actually all adults 18 and over, it's recommended to get tested at least once as an adult. So hepatitis A and B have vaccines, so it would be a good idea to make sure you're up to date on your Hep A and B shots. Coming to see your doctor, we can easily check titers, and if you need a booster, we can provide that. If you're going to be traveling internationally, certainly you want to make sure you're up to date on your vaccines. And also if you're traveling internationally with Hep A, for instance, because of how it's transmitted, you want to be aware of your food and water supply and do the best you can to try to make sure that it's safe. Be aware of the sanitation around you, and practice good hand hygiene. Hepatitis B and C, because it's spread via body fluids, you want to practice safe sex with a barrier method like condoms. Certainly using dirty or shared needles would be a no-no. If you do use IV drugs, there are some needle programs out there so you can get safe, clean needles. And then I think it's worth mentioning that if you are getting a tattoo, just make sure that the parlor you're going to is reputable and using sterile or aseptic technique. So for hepatitis A, there's no specific treatment, but the good news is it's usually self-limited, meaning you'll have it and it will run its course, and as long as you stay hydrated, you'll do okay. Again, it doesn't turn into a chronic infection, so you have it and then you clear it. Hepatitis B, there are some treatments, not really for acute hepatitis B, but if you develop chronic hepatitis B, there are some treatments. There are no actual cures. So if you do have chronic hepatitis B, you would be under the care of your primary care doctor and probably a liver specialist. And then hepatitis C, we actually do have good treatments and for both acute and chronic hepatitis C, and oftentimes it can be cured with the treatments that have been developed in the last 10 years or so. And that's the good news.